Welcome to this session. In this session, we are going to see infection prevention and control for patients with respiratory infection with emphasis to the new disease COVID-19. Basically, the learning objective of this session is to describe the general principles of infection prevention when caring for patients with acute respiratory infection. We will try to describe a specific measure to take in the hospital when caring for patients with severe acute respiratory infection, including those patients with pandemic or epidemic potential, like the COVID-19. And we will try to describe how administrative and other controls should be applied to implement the infection prevention and control. So coming to the general principles, healthcare workers and supporting staff who works in healthcare system or in health facilities are at risk of exposure for serious, even potentially life-threatening infections. Therefore, the purpose of this session is to assist healthcare workers, hospital administrators to understand and also properly apply the basic principles of infection prevention and recommended practice. So the general principle comes like recognizing suspected patient early and rapidly and apply appropriate source control, apply routine infection prevention control practice like applying standard precaution for all patients, apply additional precaution in selected patients depending on presumed diagnosis. When we are not able to make a diagnosis, we have to apply the infection prevention and control method empirically and collaborate and communicate with healthcare facilities in infection prevention and control infrastructure. So basically, when we come to the infection prevention practice that should be applied for COVID-19 or severe acute respiratory infection, there is no new earth-breaking finding. All things has been there, but we have to strengthen what we know and what has been known previously. So the CDC guideline, which has been developed earlier in 1996, which operate at two levels. The first level of the CDC infection prevention guideline says apply standard precaution, and the second level is transmission-based precaution. So standard precaution is basically should be applied for all patients all the time in all places. So this standard precaution basic principle says consider everyone as potentially infectious and susceptible to infection. Therefore, we have to apply this precaution irrespective of the diagnosis to all patients, all the places and time. And the second level of the precaution is transmission-based precaution, which should be applied for hospitalized patients or even in nursing home care and others who has a known disease, or we can apply also this empirically. So what are the components of the standard precaution? So this standard precaution which we mentioned, which should be applied at all time when caring for all patients, has this component. The first one is hand hygiene, followed by respiratory hygiene, personal protective equipment, according to the risk of the patient, safe injection practice like sharp management and injury prevention, safe handling and cleaning and disinfection of patient care equipment, environmental cleaning. These are the housekeeping, how to clean the room and other equipment, safe handling and cleaning of soiled linen in the laundry, in the hospital laundry and other health facility laundries, and finally the waste management. So a proper waste management is part of this standard precaution. So for today, what we are going to emphasize is on the three things to focus on COVID prevention. We will try to emphasize the first three: hand hygiene, respiratory hygiene, personal protective equipment, according to the risk, and the others. We encourage people to read the CDC guideline, the international CDC guideline, or WHO manuals, or the Ethiopian Health Minister guidelines. So the first infection prevention principle and practice that should be applied for all patients is hand hygiene. So hand hygiene is first standard precaution that should be applied for all patients, and hand is the principal route of cross contamination. So we transmit diseases by touching people, by touching surfaces, and that is why hand is said to be the principal route of cross contamination, and that is why hand hygiene is the single most important infection prevention practice. So hand hygiene should be applied for all patients. So when we apply hand hygiene, there are things that we have to consider. The first is use appropriate product and techniques. So it can be an alcohol-based hand rub products if hands are not visibly soiled, or a soap and water. So the basic principle is, if your hand is visibly soiled, or there are dirt, debris, or organic matter in your hand, the preferred way of hand hygiene is using simple hand washing techniques with soap and water. You can use a plain soap, and it can remove the visible dirt and contaminate or any transient microorganism, which are the principal things for cross contamination. So wash your hands for 40 to 60 seconds, and you have to rub your hand with the soap for at least 20 seconds. So that is the basic principle. But if you don't have access to sink and water, then an alcohol-based hand rub can be used. This alcohol-based hand rub, like 5 ml of the alcohol-based hand rub, you can rub all the surface of your hands, giving an emphasis to areas like the fingernails, and as well as between fingers. So you have to give an emphasis to this area, and you can rub until it gets dry. But always remember that when you are using alcohol-based hand rubs, your hand should be visibly clean. The other important principle that everyone should recognize is, when alcohol-based hand rub used, hand washing should be parallelly applied. That means after using the alcohol-based hand rub for consecutive 5 to 6 patients, then one has to wash the hands with soap and water. So that is one thing we have to remember, because in between the tendency to have dirt in our hand will increase when we are using repeated alcohol-based hand rub. So we can use these things parallelly. So the other important thing is always perform hand hygiene when indicated, especially in the 5 moments in the hospital, like before touching a patient, before cleaning or aseptic procedure, after body fluid exposure, after touching a patient, and after touching patient surroundings. So these are the 5 moments, but wash your hands as needed also, especially in the era of the COVID. So frequent hand washing is recommended. The second standard precaution that should be applied is the respiratory hygiene, or which is called the cavity equity. So this has been developed recently, especially after the emergence of these diseases with severe acute respiratory infection in 2003, and later in 2007, and so in 2012 people has developed respiratory hygiene or cavity equity as a standard precaution to contain the transmission of infection. So the first principles of respiratory hygiene is cover the nose and mouth when sneezing or coughing using a soft paper or tissue paper, or a plain paper, or else using the